Okay. Well, welcome everyone. We're so glad you could join us this evening and maybe afternoon for some of you, depending on where you're joining us from, to learn more about the topic of immune health. My name is Melissa Boersma, and I live in Zeeland, Michigan, and I'm a wife and a mom of four, as well as an RN and a functional medicine health coaching candidate. And over the last 10 years, I have really become very passionate about getting to the root of chronic disease and illness, and really learning that we all have the power and the ability to really take back our health. So part of my mission is to bring education and inspiration to you so that you can join us in taking simple steps towards better health, both for yourself and those that you love. And I know our guest speaker tonight has those same goals and that same heart. And so I have the great honor and privilege of introducing Dr. Candace Corson, or Dr. C, as she's affectionately known to many of us. And Dr. Corson, I'm going to read her bio here for you. She received both her college degree and her medical degree from Yale University, and was part of the first class of women at Yale back in 1969. She did her residency in family medicine at the University of Rochester. She's been married for 47 years to Dr. George Knowles, who is an emergency physician, and they have 4 sons and 5 grandchildren. They serve together as non-commissioned officers in the U.S. Public Health Service in North Carolina. And Dr. Corson later entered functional medicine and studied nutritional therapy to help patients recover better from chronic illness like asthma and autoimmune disorders. She's the medical editor of the book Medicinal Plants of North America. She's also a health educator on the topics of nutrition, health recovery, and environmental illness. And last but not least, she's a presidential marketing director plus with the Juice Plus company, and she's been an affiliate with them for 22 years. So I would love to welcome Dr. Corson, and I'll turn our time over to you as you share about immune health. Thanks so much for joining us tonight.
Thank you so much, Melissa. It's so good to be with folks. You know, everyone wants the best for themselves, their family, their little ones, their elders. And we find that in today's world, people don't have the degree of health many times that they wish they had. And we're seeing just a greater level of illness today, and especially even acute and chronic illness, and right now respiratory infections in little kids across the country in a higher rate than we've seen in a very long time. So the good news is that there are great things that people can do proactively for their health that are simple, that are made from nature, that are bringing nature into the body. And I just wanted to mention a few things that we all know and sometimes need encouragement to try to avoid most of the time, and then really focus on the pluses, the things that are easy, good, and wise and proven to help us when we add them. So I just want to mention the role of stress. I think all of us know that stress suppresses our immune system. And yet sometimes all of us, I find, are astonished about how powerful that is. We're reminded once again when something happens to us or someone we love, someone we know, stress suppresses our immune system. So what we want to do is just recognize that, be kind to ourselves, be kind to others, and try to create as nurturing an environment within our families, our homes, and our communities as we possibly can for that very reason. So another thing that suppresses our immune system is sugar, what I call free sugar. Now, that's not eating an apple. An apple is so perfect. It's nature's package. That's good sugar. I mean, that's carbohydrates to run our body, paired with at least over 10,000 known molecules in the single apple, all of which are good and important for us and work together. And they only come that way, the right way, in the package from Mother Nature of the apple. But when I'm talking about sugar is free sugar or processed sugar, that which is extracted in a crystalline form out of whether it's sugar beets or whether it's sugar cane. Those are things, beets and cane are things that are great to just chew on in nature. That's not going to hurt you, and it's going to have minerals in it. It's going to be very nice. But when we boil it and extract it and then crystallize out the sugar molecules, that's a problem. And I think all of us know it's a bigger problem than we realize. We do know that many years of research have shown that when we do that, when we have a sugar load, an added sugar load that would not be found in nature, we do suppress our immune system that way for at least 6 hours. So it's just nice to know it's not like talking down to ourselves or naughty, naughty, but especially if we're dealing with chronic illness or if we're sick with an acute illness, it's just nice to know that kind of pushing that aside is going to be our helper, along with adding some good things. And then toxins, common household toxins, those which we can avoid, those are smart to avoid. So it's really easy to get toxified. And in fact, I just saw an article yesterday in a medical newsletter about a very nasty toxin that's in a lot of dishwasher soaps, the kind you pour in your dishwasher, the powders. And it's now been found to injure our gut lining and be a predisposing factor for all kinds of chronic illnesses. And I know my sister-in-law, who's just so brilliant and so lovely, years ago, she pinpointed her dishwashing compound that she used in her dishwasher as the source of lesions in her mouth that were not normal, that were painful. She figured it out somehow, because the residue is on there. The rinse does not take it all away, and she eliminated that and immediately got so much better. So just things like that. Anything we can. I know a lot of our friends are making businesses out of non-toxic. They're marketing non-toxic compounds for your household cleaning, whether it be, silver in the Norwex cloths, or whether it be, vinegar is the main thing that I use at my house, vinegar and or baking soda. And you can just get so much cleanness going on and so non-toxically, it's really fun. So we just need to free ourselves up and just support each other, I think, in learning and encouraging each other. So those things are things to avoid. I would say for people who are dealing with any kind of chronic or recurrent over and over again infections, especially respiratory infections, it's important to realize that cow's milk, we don't have any quarrel with cows. I love animals. I love farmers. We need our farmers so desperately. At the same time, that particular product, anything made from cow's milk, is not really suited to the human being, especially after infancy is over, because it's a rapid growth food. It is food to signal. Food is signals. Food is messengers. Food, it signals our body specific things to do throughout our body. And that's a signal for a very large infant that weighs maybe 120 pounds at birth, which is a baby cow, to put on hundreds of pounds in that first year or two. So to grow rapidly, it's a rapid growth food, and it has specific signals inside there that are not put there by the farmers. They're there from nature, and things like insulin-like growth factor. And so when you do that after infancy, whether you're a cow, and cows never do that, or whether you're a human, it's actually wrong species and wrong time of life, then you're in a problem, especially when it's a daily thing, because you're pushing cells to divide and grow before they're ready. And you're also causing inflammation. So for a lot of people, I can remember when I was taking care of students at Notre Dame, I wasn't a physician at Notre Dame, but in my family practice in South Bend, I'd see students sometimes from Notre Dame, and I can remember sometimes they were so angry, and I could relate. They were angry because they were sick and tired of being sick and tired. And so I would just help them a little bit by finding a few things that they could take out and then putting good things in. But one of them is milk and its products. So again, no vendetta against that industry. But it's just nice to know it's not a bone builder, it's a bone weakener. That you can read all about that if you want to look up pH balance or acid-base balance in the bloodstream. But the countries that drink the least milk have the least osteoporosis. The countries that drink the most milk and eat the most dairy products have the highest osteoporosis. It's not their ethnicity, it's the intake of concentrated animal protein over and over again. So it's not a source for building bone. And that's kind of relieves a lot of people feeling that they're leaving something out that's important. But I just want to share a little bit my story, how I came to be interested in nutrition. And really it centers on when I entered the public health service. My husband and I, as you had shared, Melissa, we did serve as non-commissioned officers in the United States Public Health Service as soon as we finished all of our training. we had a scholarship in medical school that we're ever so grateful for from the National Health Service Corps. We were the first group to see that program, say, yes, this is me. I want to do this. I want to serve my country. And we were in the first group that went in under President Jimmy Carter. And so then we owed time to serve where we were assigned in the public health service. And we went to rural northeastern North Carolina, which is very poverty stricken, has some of the highest hypertension rates in the United States, and just a lot of chronic illness. And that's where I began to see, because we don't get nutrition education in medical school, and mostly not in nursing school either, I began to see what I call the wages of poverty. And that's, really thick charts. We used to do them by hand then, pen and paper. And we would see people with multiple, the chart would be, that thick, and it would be falling apart. And then we'd start a new chart. And I had a couple of darling teenagers who were sisters. They were the sweetest gals, and they were, young teenagers, maybe 15, 16, and they were chronically ill, and they just didn't feel good at all. And I asked them a little bit about, one of them had, we would call it a cystic mastitis. And I asked her about, did she drink any caffeine? She said, yes, ma'am, I do. And I said, about how much do you usually like to drink? And she said, well, 10 cans a day of Pepsi, 10 cans a day, every day. And I asked her, where did it come from? And she said it came from the school vending machine, and 10 cans a day. Now, she didn't realize that the inflammation and problems with her breast tissue were aggravated by that level of caffeine. And she was glad to know there was some way she could maybe escape that, because it was so uncomfortable. But it's just that kind of thing people don't know, and they do want the best for themselves. But in a stressed, busy world, sometimes this kind of information is missing for people. So, and we don't want to be, judgmental, coming across judgmental. We don't want to be judgmental towards ourselves or anyone else. And so it's, don't you find eating what we decide to eat is quite personal? So I like an approach where we're compassionate, loving, caring, and also relatable. So I used to eat huge amounts of chocolate when I was under stress in my training, and I ended up with that same kind of problem that my teenage patient had, and even ended up with ultrasound, needle, guided needle biopsies. I mean, it was a mess. It was all from me overdosing on chocolate. So when I realized that, I was able to take some control over that. And that was great to be able to resolve that. So when I was in the public health service, the first patient I saw who really made my mind start turning was a little guy about 3 years old, cute little boy. He had ear infection, and he just didn't feel good. And I was looking in his mouth to see, how his throat was. And this is where I saw where he would have had teeth. They were just little black holes, nothing but little black holes in his gums. I'd never seen that before. So I excused myself from the room. I said, I'll be back right away. And I went out and I found my physician assistant, who was amazing. He was older than me. This was, 40 years ago. He had been a medic in the war in Vietnam, and he was extremely knowledgeable. And I asked him, I just whispered, because you always want to be just respectful of everybody. I said, what is that? And he said, because he knew the patient, he said, Dr. Corson, that is Pepsi Cola for breakfast. And these little kids, their parents love them. They were getting a bottle at night with Pepsi in it, and they were having a bottle in the morning with Pepsi in it. And the parents didn't realize that the acid and the sugar were producing a situation where their baby teeth were destroyed. And that's a real problem, because the permanent teeth, the buds of those lie right underneath. And so they get injured as well. So that's when I started thinking, this is a bigger deal than I realized. And then over time, I think the biggest clinical problem that people had that caught my attention and really got my heart was asthma. Asthma increasing, it's still increasing across our country and across the world, and asthma deaths. And we were taught in medical school, we were taught a lot of very good things, very important, very true things. And one of them was, quote, no one should ever die of asthma. And I believe that passionately. And yet we still see it happening. So I started to find out, I wanted to find out, what is is this about? And it turns out over time, we learn more, it's about immune function. It's about the inflammatory cascade. It's about the thermostat, if you will, in our body that sets the immune system to be absolutely precise as nature can possibly make it, or out of balance. And in today's world, we're out of balance. And so it all comes down to the gut. And we've heard about healing your gut. How many people have heard about healing your gut? It's so much about healing the ecology in there, where we have germs in there that are supposed to be there. They have to be there. We can't live without them, and especially the good ones. So there are hundreds and hundreds of different kinds of good ones. We don't even know all the names that we have given them. We don't even know all of them yet. But in the last 10 to 15 years, the field has advanced, because the only way you can tell what these little guys are, who they are, is by DNA, their DNA. So mapping their genome, and that's called the microbiome, the microbes biome. So you can't culture them. Almost all of them they will not grow in the lab. They won't. They'll only grow in a healthy human gut. And so you can tell them by their DNA signature. And what's amazing, this is a very expanding field of knowledge, it's super important, is that there are more of those little guys. I call them the good little guys. There are way more of them in our body than there are cells of our human body. So we have about 10 trillion cells roughly in our body as adults, and we have about 100 trillion of these good little guys, and some that are problematic as well. So there are way more of them. They are tiny, they're one-celled, and some of our cells are big cells. You know, our brain cells can go all the way from here all the way down. Then the axons can go a long way. So we have bigger cells, but there are way more of them, and they're supposed to be there. Why am I spending time on this? To cut to the chase, we are injuring those little guys every day, and we don't mean to. We don't want to, but it's happening. So give you a big wake up, is that the first dose of antibiotics under the age of 12 months has been followed and shown to double the lifetime risk of asthma. First course of antibiotics, it might be 7 to 10 days. Now, if you look at large numbers, they have a double their lifetime risk of asthma. Why? Because we've lost the good germs, whatever we're trying to treat. And antibiotics are a blessing, but they're always a double-edged sword. So when we wipe out those good germs, which always happens, then we have something that happens in our gut called upregulation. It means we're going up on inflammation. Inflammation is upregulated by losing our good germs, because they keep our inflammation at the right level. If that makes sense? So we don't want to be destroying those good germs. And so my passion in this part of my life is helping people to get a healthier immune system for themselves, to support their immune system in such a way that their need for antibiotics goes down over time. Does that make sense? So that their body is calling for less episodes of needing antibiotics. And that's a positive cycle as opposed to a vicious cycle. So a lot of times with asthma, and I won't spend too much time on this, but just to say, what we see is a vicious cycle. Nobody starts it on purpose, but it happened to my son when he was 15, healthy son, always healthy. Their school installed vending machines when my son was 15 and his little brother was 13, and I have 4, and the older ones were at college already. But these two at their school, vending machines arrived, and they're still there. It's a wonderful little private school, and those machines are still there. So I'm glad they came. This was 22 years ago, because what I saw happen changed my career from being in the office, family medicine, functional medicine, to what I do now, which is the kind of things we're doing tonight, is, exchanging information and helping people to take their health back. And what happened is all the kids, not just my sons, all of them stopped eating plants. Not that they had eaten tons of plants before, but whatever they had eaten, like my kids, they would eat apples with peanut butter, carrots, salad at home, but they'd eat those other things in the car when I picked them up. It all stopped within the first week. What we know now, and I didn't know it then, I just watched it happen, but what we know now, why did it happen? This was 22 years ago, is that their microbiome changed within the first few days. And that's what happens. We can change our microbiome quickly and it can quickly degrade. People under stress, if you have a sick one in the hospital, you're trying to grab food where you can. And most of us start to feel a little bit worse and worse because we're off of our game. We're not getting as much fresh things. And the bottom line is that these good germs, the ones we need, they're all plant eaters. That's a key takeaway. They're vegan. It doesn't mean we all have to be strict vegan. It does mean we need a rainbow of plant foods. The higher the quality, the fresher, the more enzymes in there, like picking it in your garden, the better quality for those good germs. When we feed ourselves, anything we put in our mouth, it's feeding those germs. And as we feed the good ones, they do battle and they stand their ground and they make the bad ones behave, in short. When we use antibiotics, and again, what a blessing when we absolutely have to, we kill a lot of good germs, and we also give free rein to pathogens that are resistant to the antibiotics or other organisms that aren't even touched by the antibiotics, like fungi. If any of you have known people with yeast syndrome or fungal overgrowth, candida, this is what has happened, and antibiotics are virtually always involved. So, what I realize is that if we can help kids and grown-ups at all stages of life have a better functioning immune system by feeding those good germs, we're going to have that positive cycle where they're going to see less and less antibiotics because the doctor and they will not need to be choosing that option as often. So it's exciting. And this is what happened. I knew I needed help for my kids. And this is when I met a new friend, Susan Wittenbach, who's become a very dear friend of mine from Michigan. And she just asked me a simple question. She said, if it could possibly help your children, would you be open? And I love those words. They're so kind and thoughtful. Would you be open to seeing the medical clinical research at universities on this concentrated plant food that I use, that she used, called Juice Plus? And this is not a sales event tonight. We actually don't do sales events. We're all about real health education. And I'm going to give you some resources if you'd like to follow up with fabulous health education resources for you. But you can learn more about this free program for children. That's what I fell in love with by asking the person who invited you to this call. But it's called Healthy Starts for Families. And that's what she shared with me when she saw that I did love what I saw in the research. These are third-party independent studies, universities, experts in their field. They are, doctors, PhD experts who either she or he is an expert in the immune system or an expert in heart physiology or expert in brain health, expert in dentistry and wound healing, those kind of things. And she just asked, would it make sense to you? Would it make sense to add one of your kids for free? And if you wanted to get started, we could add a child for free. And I said, yeah, let's do that. It took me a while to decide that. And one of the big reasons for me is that I can't swallow capsules. And I say that so freely because a 10 to 15% of grownups, in my experience, they cannot swallow just a standard size capsule. These are not big. They're called 00 or 00, which is standard capsule, not a horse pill. But they can't do it. They know they can't do it. And it's an airway problem. It's not, they're protecting their airway. It's not a psychological thing. And that's the case for me. And I just thought, I can't deal with this. However, I realized I can open them. And that's what I've been doing, guys, for 22 years. Very easy to open, put it in my water, shake it up, drink it, do that once a day. I can always double or triple that if I'm flying or having any kind of big challenges. But very easy to do. And there's also a chewable form. And I choose myself the dried powder form of the Juice Plus because it is basically no sugar. You're not taking in sugar. It's not concentrating sugar. It's crushing fresh plants grown by farmers just for making Juice Plus, 30 specific species of vegetables, berries, and fruits, and crushing them at the peak of ripeness, without pesticides, without herbicides, without heavy metals. And they crush the whole thing, the peel, the seeds, the skin, the stems, everything. So it's actually so far superior to juicing. And I think the name Juice Plus just made me back off when I heard about it 30 years ago is when I first heard of it and did not pay attention. But when I realized more about it, it's one of the great breakthroughs in human nutrition. So I decided to do that. Let me do that. My kid won't take it if I don't. And I thought I didn't need it because I was healthy and felt as strong as I could be and eating healthfully, which I was most of my life. And I just started doing it. It's safe, it's food, it's proven to be good for people. My kid needed it. And long story short, I fell in love with this whole idea of gifting this concentrated nutrition, it's functional food for children. And our program has been from age 4 to 18, and then 18 and up if they're in college full time. And as of May 1st, it's expanding to be age 4 through age 25, age 4 to through 25, so to the 26th birthday. And they don't need to be in college. Any child, whether they're in college or not. And this includes young people in the military. It includes young people who have disabilities like Down syndrome or any kind of problem where they're not earning. They can be on Juice Plus with their parent or grandparent. And I just love that. So this made a huge impression on me when I saw not only did my son have total improvement, but I, after about 6 to 7 months of being very faithful so that my son would do it, I became much stronger, much more focused, much better mental clarity. Did not expect that. And now after 22 years, I find that my bone health is so superior to what my relatives had. My mother had very severe osteoporosis. My sister has osteoporosis, and I do not. And I just think it's the benefit of adding plants and doing it in a way that's gentle, that's well proven to be helpful, that's economical, and just flat out makes sense. So that's the biggest change I have seen for people with their immune function, taking down stress, taking down toxins as much as they can without obsession or worrying about it, and adding more plants. And what that does is it changes our metabolic programming. And that means that our tastes change. That's what happened to my kids in reverse order. It happened to them in positive order. They actually stopped wanting pop and things like that just because it didn't taste good anymore. And you guys, I feel like most people can't believe it. I couldn't believe it until I saw it myself. I heard about it, but I didn't believe it till I saw it myself. And now I'm just used to seeing good things happen, and it's just a joy. So those are things that are really important for immune function. And I would add one more thing, because the environmental part that people can do is get a good quality HEPA air filter, at least for the bedroom of any person, child or adult, that's having chronic respiratory problems. It makes a huge difference. And just to be breathing, even if it's 7 or 8 hours a day during that time, to be breathing clear air without a load of damaging toxins, it resets also the immune system, and people need less medication. And that was shown years ago. There was a study that Medicare did in one of the states, I think it was Illinois, using a bedroom air filter for kids with asthma, and their med use went down by 40% with just that one intervention. And I think it goes without saying, but I should just say it, cigarette smoke. It's so hard to not smoke if you are a smoker. I have complete empathy for that. It's just that it needs to be outside the house, not in the garage, not in the basement, not in the attic, because it all equalizes throughout the whole dwelling. But in households where there is any cigarette smoke at all, the respiratory infection rate triples in kids, triples. So that's a neat way where people can just smoke when they need to, but outside. And of course, that's not fun when it's snowing, but a lot of parents, they will do that for their kids when somebody takes the time to share the difference it could make. So I just want to stop right there. If anybody has any questions, if you've seen any questions in the chat. And while you're looking for that, Janai, I just want to mention this beautiful resource called thefreedomrevolution.com. It's thefreedomrevolution.com is a public website, and it has a section called trending videos. And those are all wonderful health education videos by doctors. None of them are paid to do so. And people really love that. And the other one I love is called healthylivingaffiliates.com. And that's a place where there are superb webinars that are short, concise, in-depth on the physiology, how our body works, that people are loving. So that's healthylivingaffiliates.com.
Thanks, Dr.
And for
Corson.
people who like to read, I love the other Dr. C, Dr. Joe Canizaro's book called The 4A Epidemic, Answers to the 4A Epidemic. And the 4A's he writes are asthma, allergies, ADHD, and autism. There's a common impacted area, and that's the gut and the microbiome.
Mhm.
And so good news is that we can help it, and we all need help on that in today's world. So thank you so much for caring so much, and I hope this has been helpful.
Thank you, Dr. C. If anybody has questions, we're just having, if you could put them in the chat, and then we'll kind of pick a few there. If anybody has questions on anything that Dr. Corson talked about in the last few minutes related to immune health, or any of the pieces that she talked about, feel free to post it in there. I took notes. I'm sure I saw other people looking down. It looked like they were writing, so I'm sure people got some good notes. And I think what I took from it is that it's holistic, right? There's not just one thing we do to help our immune system. It's not just one area. It's very holistic, and sometimes that can feel overwhelming because it's like, okay, I've got to manage my stress, and I've got to reduce my toxins and stop, reduce the sugar and the dairy, and get my gut healthy and eat more plants. But I think any small step we can take, I think one step, what I found, and I think what our healthy living community has found, is we're all about simple steps. So, pick something and try, maybe it's a month at a time. This month I'm going to work on this section. I know that's just a tip that has worked well for our family, because I think our health journeys it's a journey, right? It's not like, okay, we're going to switch everything now, and that can be really overwhelming. So
yes, absolutely. That's such a great point, Melissa. Nobody needs to feel like they have to undertake everything at once. That's just not fun. But
no.
pick the fun things that appeal to you. And that's why I love we call it one simple change.
Mhm.
One simple change is adding Juice Plus, either the chewables or the capsules or the opened capsules.
Mhm.
And that makes such a proven difference. And it really is easy to do, and it really is economical. In the end, it's greatly money saving for so many families that stick with it. They find that the balance of what's happening for them is very favorable to their health and their enjoyment of life. And so many times less medical visits and less antibiotics and the whole nine yards.
We've found that at our house. We started eating Juice Plus about 9 years ago, maybe 10. And that's one of the main things we noticed. We still get sick sometimes, but it's much less often, and it's much less severely. So I was really relating to your story when you said, well, I didn't think I really needed it. I started it for one of my kids to sponsor him for free. We have an adopted son who came into our family when he was 9, and he was really small. He got sick all the time. He was a super picky eater. He got strep like all the time. And so I started it so that he could get his for free. And we saw wonderful changes in him. He actually, and we can't promise this will happen, for you if you struggle with strep, but he never got it again after he started Juice Plus. And for myself, I noticed, more energy. I started sleeping better. And my sinus infections that I would get here and there, they went away. So I think it's a good catalyst for other healthy changes too. Okay, so someone's asking, do you have a recommendation as to what to drink or use besides cow's milk? And she said oat milk, coconut milk, almond milk, etc. Is that something?
Oh, that's a great question. Yes, I would say any plant milk. So a plant milk is that which is made from crushing seeds that have good things in them. So or grains. So oat milk would be great. My personal preference is organic soy milk. That's what I like. And that could be a whole other call, the benefits of soy and the controversy and misunderstanding around it. It is an estrogen blocker. It's an estrogen blocker. So it acts like a natural form of tamoxifen. And that's a good thing because it reduces risk of breast cancer and it reduces risk of prostate cancer. So, and we're talking about non-genetically modified natural soybean as part of a healthy nutritional plan. It's a good source of protein. And then any kind of plant milk would be fine. Almond milk, a lot of people like. There's an environmental problem with almond milk if people care about that, and that is that almonds are being overgrown. They require a massive amount of water and also bees to pollinate them. So it's actually a problematic plant to grow on a large scale where it's not supposed to grow. But I think any plant milk that you switch to, and you can even do half and half, to switch kids over, that's a fun way to do it. I used to be a huge milk drinker, and I've just changed a great deal because I would love to decrease my risk of breast cancer. Who would not? Mm-hmm. So, and a treat now and then, we don't have to be afraid of, a healthy treat. Well, I won't say healthy, a delicious treat now and then is a choice we can make consciously. But I'm talking about consuming something every day because you think it's good for you. It's nice to know more balanced facts about it. Yeah. So any plant milk would be fine that you're not allergic to.
Someone's asking about organic goat milk. Would you have the same answer as cow's milk with that?
Well, that's good. Yeah, it's a good question. So it's still an animal protein. It really depends on the health of the person and what they're trying to achieve, but it certainly could be a better alternative to cow's milk. And part of that is if you look at the size of the animal, the size is approximately, if you look at the weight and the size, about like a human being.
Sure.
So not like a cow. So it's a much, the signal to grow rapidly is not as intense, and it fits the profile a little bit better. So I think, that would be something, if it's well tolerated, that's fine. But I think the interesting reason is, why are we looking for animal milk? And I'm not putting that down. That's what we want to ask ourselves and find out, I think. Why are we looking for animal milk? And animal protein is something that does drive established cancers. It's all about balance. So again, as a healthy, as a fun treat now and then is a different thing from an everyday thing. People really need water as their main beverage, but it's nice to have something on it, let's say a healthy cereal or to cook with. And I think plant milks and shakes, plant milks work great for that.
Great. Good. Thanks for that answer. Another question, if you're okay with it. Someone is asking if they have a soybean food intolerance, can I use the Juice Plus products? And then the second part is, can this intolerance go away as my gut heals?
Oh, great question. So first of all, what I've been talking about with Juice Plus is the capsule essentials, which is the berry blend, the veggie blend, and the fruit blend, and the omegas, which I didn't even touch on, the plant-based omegas, which are marvelous. All of those 4 capsules, they have no association with soy whatsoever. There's no soy in any of those at any degree whatsoever. The only product that we have that contains soy is our Juice Plus Complete, which is a meal replacement, completely different from the capsules. It is something I use. It is something I love. I've been using it every day because I love it so much, and it's so good for me for 22 years now, and it's good for bone health. And there is a non-soy version of that coming out later this year in 2023. So I would say for some people, an intolerance may get better as their gut heals. I do see that often. For a person who has a history of anaphylaxis, which is a sudden severe allergy and they need a shot of epinephrine, avoid whatever that is completely. So if a person has anaphylaxis to legumes, which soy is a legume, the bean family, or specifically to soy, I would say just don't ever do it. But you could do the capsules, all 4 of our different kinds, without any problem.
Mm-hmm. Great. Thank you. I think I got all of our questions answered that were in there. So thank you for being willing to be put on the spot there, and for just taking the time to share your knowledge. I know you have a great amount of knowledge and experience and life experience with the things you shared about. And I know you're passionate about educating people and inspiring people, which is, what our community is all about. So I love that you took the time to share with us tonight. And for all of you who are on tonight to listen and learn, I hope you have a few little tidbits to take with you. And we did record this. So if you know someone who wasn't able to join us, or you think would love the information we shared tonight, get with a person who invited you, and they can get you the recording of this after in a day or so. So wonderful.
That sounds, thank you so much. And I would just say, let's just send love out there. It's so needed in our country and our world today. And I think all the children deserve so much better than what it's looking like right now. And I think we can do that with love, taking care of ourselves, having good energy, loving our planet, loving each other, and loving all the mommies out there, because and the daddies, of course, and the grandparents. But I wish that every pregnant mother could know what we're talking about here tonight and be supported through their pregnancy with the Juice Plus Essentials, because it makes a huge difference for them and their baby and that future generation. Mm-hmm. So we're doing a good thing, and we're so happy to have this family to be part of. So thank you all so much.
Thank you, Dr. C. Have a beautiful evening, everyone.